My first video will be on dislocation reduction, and I'm going to be showing an upper extremity relocation, specifically the shoulder, using the Boss-Hozak matter maneuver. Before attempting a relocation, you want to move your patient to a safe area and try to calm them down. Indications for this technique is an anterior dislocation, being older than 18 but not a senior, fracture is ruled out, and the neurovascular integrity may or may not be compromised. After checking for and ruling out fracture, you want to check and note PCMS and pulse at the distal extremity before beginning. I chose the Boss-Hozak matter maneuver because it is the technique that has the highest reviewed success rate. And so what you have your patient do is bend their knee, hug around their knee, and slowly lean back until the joint relocates and there's immediate pain relief from the patient. Assuming you were able to reduce the joint on your single and only attempt, you want to make sure you again check PCMS, pulse, and range of motion afterwards. When it comes to post-care steps, you want to immobilize the joint, so a shoulder sling would be appropriate for this, and send the patient for imaging. And then you want to instruct the patient to either call you or 911 if anything starts to change, like numbness, tingling in the hands, change of color in the skin to pale. And from the imaging results, you want to set up a rehab program with your athlete to strengthen and get them back to play if that is their goal. For my lower extremity dislocation reduction, I'm going to be showing a patella reduction using the patella dislocation technique for lateral patella dislocations. The biggest indications for this injury is that fracture is ruled out and that it is a lateral patella dislocation. I chose this technique because it is the most widely used and all the evidence is based on expert opinion in review articles. Again, before attempting a reduction, you want to rule out fracture, check for PCMS, and pulse at the distal extremity. To administer this technique, you want to gently extend the knee and apply a medial pressure on the patella while lifting up the most lateral edge of the patella over the femoral condyle. The knee will realign and regain a normal appearance. And then again, after you attempt your reduction, you want to make sure you check PCMS and distal pulse. When it comes to post-care, you want to immobilize the leg and extension with the knee immobilizer, and then you want to send the patient for an orthopedic follow-up as well as imaging. And you also want to instruct your patient to either notify you or the emergency department if they start to have any numbness or tingling in the distal extremity. And then follow-up looks like a rehabilitation program designed to get the athlete back to play if that is their goal.